In health news today, here in the Valley, there's one place you can go for all your breast health needs. It's at the Virginia G. Piper Comprehensive Breast Clinic at the HonorHealth Deer Valley campus. From mammograms and medical treatments to counseling and consultations, it's all under one roof. We're here now with Dr. Brenda Moorthy, an affiliated physician with HonorHealth. And doctor, let's talk about it being October almost, so that is Breast Health Awareness Month. When should women start thinking about getting their mammogram?
What a great question. So the American Cancer Society, along with the American Society of Breast Surgeons and American Society of Obstetrics and Gynecology, recommend that for normal risk patients that we start our annual mammograms at the age of 40. Now, if you have risk factors such as a genetic mutation that gives you a genetic predisposition to getting breast cancer or a strong family history, then you might want to talk to your physician about starting imaging earlier. So sometimes we'll start imaging almost 10 years earlier than the youngest relative. So at HonorHealth, we also have a comprehensive cancer prevention clinic that actually assesses patients who are at high risk and creates a tailored surveillance plan for them.
Now, what about COVID? Has that changed anything?
So, great question. So in March of this year, when COVID hit, we were actually discouraging women from getting their screening mammograms. But now we want to make sure that the message is clear that we want patients to go get their screening mammograms and not put off their screenings. So HonorHealth, along with Smile Imaging, have really good safety precautions in place so that it is safe for you to go get your imaging.
If you do get a screening, you find out that there's something to worry about, you have a diagnosis, what is the next step?
So one thing I want to say is that if you do need to see a breast specialist, that a lot of us will offer televisits if you have to go to the hospital, that we do COVID screening before a procedure is performed. So if a patient is diagnosed with breast cancer, then sometimes those diagnoses can be very complex. And so, but the next step would be that your primary care physician would refer you to a breast specialist. A lot of the complexity comes from the fact that multiple specialists are involved. So when you see a breast surgeon, they oftentimes will coordinate your care with multiple specialists, and that it becomes your team.
Yeah, and what would you say makes this service and this clinic so unique?
So the Virginia Piper Cancer Clinic is a multidisciplinary clinic. So we are streamlining their care from the time of their diagnosis. So we have experts who are in one building and services that are in that building as well. So it makes the actual workup and treatment planning that much easier. The soul of our clinic lies with our Navigator. So we have a breast navigator that calls the patients and welcomes them to our clinic. And that's really that human connection is so important when patients are scared. So she coordinates their appointments in a timely fashion. And then once the patient has seen all of the expert physicians, then we meet as a tumor board and discuss the care. We can then develop a personalized treatment plan for every patient.
I can see why it's called a comprehensive clinic. What would you say, what part of the clinic isn't talked about enough?
So I would say the patient satisfaction. So all of the patients who go through our system really have one very common theme, that they feel relieved, that they have come to a place where their team is communicating and they feel like they're safe and they're getting excellent care.
And if you would like to set up a consultation today, all you have to do is call this number, 855-485-HOPE, or go to honorhealth.com.